I'm really excited to be here. It's been a brilliant day so far. And just to start by saying this is something a bit different because I'm not an expert in brain tumours, but the organisation that I come from, oneplusone, we are all about putting research into practice with a focus on helping people to build stronger relationships, and that's by equipping them with the skills and knowledge that they need to do so. And as has already been said, I'm here to share a bit of an insight on a project that we've been working on with the Brain Tumour charity that's all about exploring relationship experiences and support needs for couples who are living with a brain tumour as part of their lives. So I've got 15 minutes to squeeze in and talk to you today about why we began this work, how we did it, what we found from that work, and then finally just what the next steps we think should be within this project. So first of all, some of you might be wondering, maybe some of you aren't, but why the focus on relationships? Why have we taken this route? So what we know in general is that good quality relationships are good for health. And that's due to a whole range of reasons, but it could include things like the influence that partners have or try and exert on one another's health. So in terms of kind of influencing eating practices or exercise or taking medications, that kind of thing. We also know that it could be down to things like the responsibility and the desire to stay healthy that being in a couple relationship really invokes. So that feeling of kind of social support and the feeling that you're loved and cared for might encourage individuals to try and stay healthy for their partners and their families. So while what I've said there is about relationships in general, we also have seen from some research that relationships seem beneficial for those where individuals are living with a malignant primary brain tumour. Now, one study found that compared with patients who stayed with their partners, separated patients fared more poorly on a number of health markers, and that included things such as greater use of antidepressants, less participation in clinical trials, more frequent hospitalizations, and also fewer engagement in fewer treatment regimens, and there was also less likelihood of completing radiotherapy or dying at home for those who had separated. We also know, and this is partly from really great research conducted by the Brain Tumour charity, that couple relationships are often challenged when one partner has a brain tumour. And in their survey of over 1,000 respondents, they found that 2/3 had said they'd seen a negative impact on their couple relationships, and almost 3/4 reported an impact on physical intimacy. So given this impact that brain tumours can have on couple relationships, what we wanted to do was to take the next steps to find out what could be done to support couples better. And to do this, we sought insight on two overarching areas. And firstly, we wanted to look at the knowledge of, we wanted to find out if there was a gap in terms of this kind of support. Was there anything already in place? And secondly, we wanted to consider the appetite for some kind of relationship support resource in more detail, and that would be exploring both the content within that kind of resource, but also the more kind of practical details of what this resource might look like, how it might be delivered, that kind of thing. So we approach these two areas by speaking with professionals who worked with couple members, so much like yourselves, with a brain tumour, and that included, just to name a few, neuropsychologists, clinical nurse specialists, and also neuro-rehab occupational therapists. We also vitally included couple members themselves, so that was both partner members, so those living with a brain tumour, but also partners of those living with a brain tumour. And within this project, we took a mixed methods approach. So we conducted 11 semi-structured these were telephone interviews with professionals working with those with brain tumour, 18 interviews with couple members, and then we used those interviews to feed into structuring a broader survey which was sent out online. And through that we reached 370 couple members through that survey. So as I said, firstly, what we wanted to find out was firstly if there was a gap in relationship support provision. And in short, what we found out from couple members is that there is. And this graph shows a stark need for something to be done to fill this gap. So the blue column represents the answers of couple members with a brain tumour. The yellow column represents the answers given by partners of people with a brain tumour. And approximately 80% on average felt that there wasn't enough relationship support in place. And that was for those both living with a brain tumour on the right, but also not enough support for the partners of those living with a brain tumour. So in other words, about only 20% thought enough support was in place in this topic area. Now, to bring this to life a little bit, I just want to pull out a few quotes from some of the interviews that were conducted, just to kind of give you an idea of really what was behind some of these things. So, to start off with, individuals living with the brain tumour were saying things like, so this top quote here, "No one ever even suggested or acknowledged that our relationship was going to change, and certainly never offered support." And that really kind of flags two things to me. Firstly, that there was no forewarning of any changes that might occur within the relationship, and that can leave couples really unable to prepare for anything that might happen. And secondly, there was no support offered, and that's kind of self-explanatory. The second quote here flags something that came up quite frequently within the research, and that was that while the medical care was really brilliant for the people we spoke to, there wasn't much in place for, as this patient says, the softer relationship side of things. And partners said similar things to this. So both quotes here highlight again that while medical care was really great, there wasn't really anything to support the relationship. Sorry, should have clicked there. So we've got the first quote here saying that there's not really any couple support. They support me, but not really in relationship things. And another partner says, "We found it quite an isolating experience. You were sort of left a bit on your own to deal with those things around the relationship." So again, really important, for us to know that those things are kind of required. Now, this next one is something you might be quite interested in. So as I said, we also spoke to professionals. And within this group, we also found that professionals agreed that there was a gap in this kind of provision. And they were saying things like this first quote here. So, "Sometimes you just feel so helpless. If something can be developed, I think that would be so valuable. We care a lot about our patients and their families, so if we can do something to help them, that would mean a lot." And I think that's really touching. It really shows how invested these professionals are in the work they do with the couples. And another professional noted, "I'm sometimes unsure where to signpost someone to be honest. And then if those resources were in place, I think I'd be signposting a lot of people to them." Again, really key for us that that's saying that if we were to develop something, it should be used. So that's vital. So having established that there was a gap and a kind of need for these kinds of resources, we then spoke to participants about what they thought the most important topics were to be covered in this kind of resource. And the top 5 topics selected by respondents with a brain tumour were those listed here. So fatigue, adjusting to change, loss of independence, personality change, and memory or cognitive changes. And just to note that these are all being spoken about in the context of how they impact upon the relationship. And we then asked the respondents to select their top 3 most important topics within what was a list of about 20 things that we pulled together. And adjusting to change and loss of independence remained particularly important across both the patients and the partners within the survey. The third was different for the two groups, so it wasn't the same. So then in terms of planning for content, we were also really interested in finding out how couple members we spoke to coped with the challenges that they faced. So the 4 areas that were selected most frequently here were spending time doing things together without full focus on the brain tumour, communicating with the other partner, educating oneself on brain tumours, and the existing strength of the relationship. And just to note, within the resource that we developed, it would probably be the top 3 things that we would be more likely to address. That's because when someone kind of initially arrives at a resource, you can't have immediately influenced the existing strength of their relationship, but by addressing the other things that I've mentioned, hopefully in the long term that could be supported. So these areas, along with the topics that were mentioned on the previous slide, help to give us an idea of what things we might prioritise in this kind of resource. And that isn't to say that they would be the only things that were covered, but more that it's maybe about how much space would be given to those things or about where they might arrive in the resource journey. And then to move on, the participants were also asked, as I said, about kind of the best ways to approach this kind of resource. So for example, what formats it might be delivered in, the timing of delivery, and also maybe how it should be delivered to couples. And having analysed the results of these explorations, we drew together a set of recommendations that we hope would begin to fill this gap in a responsive way, given that we'd spoken to these individuals beforehand. And that's what I'd like to share with you now. So the first recommendation that we made was to develop a personalised relationship support resource in an online format. And this was because the couples we spoke to said that web-based support was their favoured format. Professionals also thought this was useful, and we think it's particularly good as it provides a really positive sense of kind of geographical reach. You can house something in one place and amend and add information, but it can obviously then reach across the country. We also see this as a potential to offer a kind of relationship support hub, and this would offer a whole range of things. So, for example, online training programs for couple members. It would house information, also the potential for housing a kind of moderated, anonymised forum where people could share their experiences in a safe place. And to support this kind of self-management and learning approach, we would also see this as having potential for additional support through specialist practitioner involvement, so through things like webinars or live chats or Q&A sessions. So really it would house a whole range of things within that. So that's the first recommendation. Our second recommendation is around developing a set of specialist audio recordings. And these would be of real experiences shared by couple members, ideally in their own voices. And the reason we thought that this was a good idea from the research is because couples really wanted to hear about others' experiences. Professionals said this was really valuable as well in terms of kind of trying to educate the couples that they worked with. And we would see this as being available both online but also through signposting from practitioners. And this is particularly important as it could provide a route of normalisation for people going through similar challenges, which can help individuals to feel that they're not alone, and may offer some sense of comfort for those couples as well. Hearing about how others managed can also provide a kind of insightful and authentic education for couple members and going through this experience. And The last point I just want to flag around this second recommendation is that audio could also potentially help to overcome some accessibility issues, so things such as visual impairments or reading difficulties could begin to be addressed through this kind of resource. So then moving on to our third and final recommendation. This is around a training offer for practitioners who work with couple members. And this training would be on how to offer a brief intervention for relationship support. And we would see this as being supported by a catalogue of other resources. So the relationship support hub I mentioned, the audio resources, so that professionals weren't kind of left on their own just trying to speak through these issues without having anything to refer to. So just to say, while OnePlusOne has delivered similar training packages to various practitioners in the past, we haven't done so with those specifically working with people with a brain tumour. So it's essential that we would plan to collaborate with brain tumour specialists to allow for the co-creation of a bespoke training package that really kind of kept those needs of those couple members at its heart and built it in right from the beginning. So that's the last recommendation I wanted to talk through. And I just want to kind of end on one last quote, which I think helps to remind us what it is that we're really trying to achieve with this work. So this is a partner of an individual living with a brain tumour. And they say, I suppose it's making sure that relationship support has equal value to all the other stuff that you've been given. Because actually it has more value in a way, doesn't it? Because the relationship needs to keep going. It seems to become a lot harder if you lose that relationship to cope with the medical stuff, doesn't it? And I think this partner really hits the nail on the head, and it takes us right back to the study that I mentioned at the beginning that showed that brain tumour patients who had separated from their partners seemed to fare more poorly on a number of health outcomes. So given the challenge faced in doing this properly, I'm going to end with a bit of a plea. So this research is essentially the first bit of what the Brain Tumour Charity a project they've initiated, and hopefully going forward the idea is to develop some resources coming out of this. But we want to be certain that these resources suit the people they're being put in place for, and also that they're going to be used. And for that, the plan is to continue to involve both couple members and professionals in the development of these. And that would be in both kind of developing content, prototyping, testing, that kind of thing. So this is my plea. If anyone is interested in kind of helping in anything that I've just mentioned, or even in just hearing about what that might involve, or just has any questions about the research, then please do either contact me or come and find me at the end. And
thank you very much, Debbie. Thank you very much.